Thank you everyone for joining. We really appreciate the opportunity just to share some of the work that we're pursuing, but more importantly, just sharing some of the practices that are going on out there in health plan land, certainly in Medicaid plan land, that are trying to support how we as an industry crack this nut of driving greater member engagement and things that we know can help our members to lead healthier, more cost-effective lives. And so that's really what we're going to speak to today. I, just by way of background, I'm going to give a little bit more of the overview of Clarity, just so that we all have perspective on sort of where we sit in the value chain and the supply chain for health plans. I would encourage, as we give the Clarity overview, not to necessarily think of us as anything more than just a stand-in vendor giving the discussion today, but all of you likely have your own vendors, be it Clarity or otherwise. And so while I'm of course speaking from a Clarity perspective today, this is by no means specific to us as a vendor. I would really encourage whomever you work with, be it internal or with external parties, to take some of the principles that we discuss here and see how they can be applied. We are also going to just talk about the importance and establish the criticality of member engagement, specifically with the considerations around Medicaid enrollees and Medicaid plans. And so want this to be very relevant to this as a line of business, knowing that there are particularities, there are constraints, there are opportunities that are represented by working within Medicaid populations. And finally, we're just going to look at a couple of real-life examples. What I know from just doing the preparation for the discussion today is that the content and what we speak to might not be relevant to your specific role if you're here as a representative of your health plan. What I would encourage is in the back of your mind, and maybe if you're jotting notes, but jot down that name of who it might be in marketing leadership, in member experience leadership, or in executive leadership. That's really who we have our richest conversations with around this topic. And so if this isn't a direct hit, that's who I would say at your health plan might be most interested and most value the content hereafter. Tierney gave most of this background, but just for perspective on kind of where I sit and where my comments come from today, I've been in healthcare strategy for really almost the entirety of my career. Just about 18 years, and that's working in consulting, both for providers as well as health plans. Have also been very close to and involved in the early days in the founding of member engagement platforms themselves. So all of those places that I've worked directly with health plans to try and give their members a richer experience and get more out of their benefits, that's really where I've spent my time. And it's what I now do as we think about what Clarity does, and we'll go a little bit further into that as well. You heard Tierney just in our introduction note that Clarity Software Solutions, there's a heavy software side of what we do, but we work with over 100 healthcare clients. And when I say that, you'll see some logos here at the bottom of the screen, really representing health plans. There are some TPAs, there are some dental plans that we work with, but overwhelmingly, we're working with medical plans and working on their behalf to distribute messaging that is relevant to their members. So to make this practical and easy, truly think about the last time that you personally received a letter from your health insurance in the mail, and that may have been an ID card that was sent to you. That may have been another notification. That may have been an explanation of benefits document. But regardless of what that was, there's a very high likelihood that Clarity is actually the partner to your health plan that on the back end of the operation printed and fulfilled that ID card or EOB for you and got it to your mailbox. And so that's the capacity in which we work with these health plans is basically saying, send us anything that needs to be mailed or distributed digitally to all of your members, and we will take care of that actual fulfillment. So just to make it a little more real life what it is that we do. That's where we sit, and that's how we work. And the way that we really focus on that is we'll talk more about what core communications are, but we'll also talk about increasingly we're in a digital world, and more members are wanting to be interacted with digitally, either as a complement or instead of by way of a paper communication. And so we'll look at both of those today. But everything that we do is focused not only on the idea that, okay, we got a letter to your mailbox, that's the end of the story. There's such an opportunity for something that's going to be read by a member to also be inclusive of language that drives them to take an action in something that is important to them and something that is important to their health plan. They just might not know how to access it. And that's really where kind of the thrust of our work in this space is there are millions of communications that are going out to members every single year. And if they're not nudging a member to take a healthcare action that's going to improve their lives and improve their experience with their benefits, then we're kind of leaving opportunity on the table. And that's what we're going to dive into. I know just personally from working with health plans across the country that increasingly you all are being asked to do more with less, or do more with what you have at your disposal, but there's not a whole lot of room for more. One thing we know that is always going to be available to you is the opportunity to correspond with your members around those requisite communications. So those ID cards have to be sent. Those EOB documents have to be sent. And in that sense, you have this sort of really stable engagement opportunity that you're going to be able to lean on and leverage. So just to reiterate, when we talk about what is a core communication, what is it that an organization like Clarity, or again, whomever you work with in this type of function, someone out there is printing and fulfilling and distributing those ID cards, those welcome letters, those member guides, explanation of benefits, as well as there are regulatory documents like letters and invoices, also 1095 documents. All of these are what I think traditionally has been thought of as correspondence, but what we are now saying should really be viewed as another engagement opportunity. And if we think about if there are marketers in the audience or marketers that hear and sort of look into this afterwards, the idea that we could have 2, 3, 5, 7, 10 more opportunities per year to be in front of a member and to have their attention, there's no way that we would let that go without saying, oh, we do want you to just register for the portal, or we do want you to download our mobile app because that's really going to help you be connected to care. That's how we're starting to look at the footprint of these correspondents that are going out to people. I might reference this just for ease of discussion today in talking about how things are received tried and true mail. But know that if you're working with a vendor, again, Clarity or otherwise, the proficiency should really be around an increasing footprint in digital engagement as well, and the capacity to look at things from a multimodal perspective. What works for me might work very differently for someone else. My preference towards receiving a letter in the mail might be totally irrelevant to someone who always wants to receive those things via email or via notification by way of text. So the ability to sort of meet members where they are is a critical skill set in whomever you're working with that member correspondence on, and it's a place that we'll talk about a little bit further today. So that's who we are, what we do. Again, regardless of who you're working with, there is somewhere out there that is kind of the keys to the castle on these millions a year, and for your individual health plan or for an individual member, might be dozens of these touch points a year. The nature of the conversation today is that we have to optimize the spend that's going into all of those communications to the tune of getting more value for your plan. And we'll talk about the how on that now. So we're going to talk initially about just what does it mean when we say effective engagement, and how valuable or how important is that really for a health plan? Going to just start off with a couple of kind of big picture stats to frame this discussion. When organizations are thinking about communicating with members, all too often what we see and what we experience is that we're really writing that letter from our own perspective and then asking the members to meet us where we are. And the shifts that we can have in terms of that sort of construct is to say, what is it that most fundamentally meets a member where they're having confusion or a pain point, or just we're meeting them where we know there's uncertainty? And so if we look at sort of member satisfaction that's been surveyed across organizations, and this persists across not just Medicaid, but duals and Medicare and commercial as well, but making sure members understand their out-of-pocket costs. And I'll caveat that simply writing what out-of-pocket cost definitions are is different than having somebody understand their out-of-pocket costs. Providing some level of health education and delivering useful reminders for preventive services. These are just a couple of the examples that we can use as a mirror back to our own correspondence to members and say, are we doing these things? And again, they're just examples, but if we can look at a letter and say, man, really all we gave was an ID card and then gave them a helpline to call if there are questions, we know that there's more value that we can squeeze out of the opportunity to write to that member. And this is to a huge degree. I mean, on a 1,000-point scale, when these things were addressed, this is a J.D. Power survey, over 200 points or 20% were the improvement opportunity just by making sure that some of these core tenets were really established. And so what does that all amount to? Well, you can think of this just even in your own life as a consumer of any product. It doesn't have to be a medical insurance product, but when you feel, and I'm sure you've all got brands in your head of the ones that make you feel understood, appreciated, a brand that is trying to urge you in the direction of getting the most value possible, those are the places where we are loyal to those things, where we have a more positive review of those things, where we would recommend them to others that might be looking for similar types of products or services. And conversely, if we're annoyed, if we're disappointed, if we're frustrated as members of a particular service or brand, we have way less likelihood, one, to stay with that if the option is given to us to make a choice and move to a different type of coverage. But two, there's just lower engagement. And what we know as sort of administrators of health insurance, lower engagement is going to lead back to higher costs, both to us as well as for financial strife for the member themselves. So bridging this gap is unbelievably important, and the correspondence footprint that you have with members is a really elegant, already in place vehicle to start upping the game in terms of driving this type of satisfaction. So aligning with exactly who your membership is a really important place to start. Again, I can't emphasize enough that if someone on your teams or you all are sitting in a room and saying, we've got to write this welcome letter to a member, how much are we really trying to get into the shoes of that member? And so if we think about, obviously the hottest topic going on within the Medicare space or Medicaid space, is just people wondering, where am I going to land following redetermination coming out of post-pandemic? And of course, that redetermination might be happening even on a monthly basis, but we know just from a large-scale numbers perspective that there's a heightened anxiety around the state of coverage. Basically, that many people are wondering, will I continue to receive what I received through the years of the pandemic? Now, most of those renewals are already done, but we also know that a ton, 30% of these are still in redetermination. I know that Illinois is doing better, I think, than the average state out there in terms of not only communication, but also pace of sort of getting members exactly the information they need to know. This is done, and we've established that your coverage has been reinstated, or whatever that might be. But it's still important to know that these types of things might be causing anxiety, They might be causing uncertainty. There's certainly a potential for misunderstanding of information or a lack of information. And so thinking through that lens as we write everything we write to a member is an opportunity to have that positive brand experience and a little bit more engagement with whatever it is we might be asking them to do. So let's use just for an example, and we'll talk about different ones today, but an example of what it is that might be really valuable for a Medicaid member in one of your plans to complete as an action. And so we'll maybe use access as our example today and say there is a telemedicine benefit that is available to a Medicaid member. And we're just trying to get as much participation in that telemedicine platform because we know it's going to help to close care gaps. Let's use that as our example today. And if that's not relevant for you, you know, think about getting members to download an app, register for a portal, select a physician, whatever that action might be. But in your mind, have something that you know your health plan is asking members to participate in, that you all are getting lower participation than you would like. Okay, so with that in mind, we can start to use, and you'll hear me say this a few times today, but what is the behavioral science of what drives action within a particular population? And as we've looked at Medicaid and duals and worked with behavioral scientists, these are some of the tidbits that I think can be really valuable to take to those correspondence meetings where we know these pieces of collateral are being developed. And so if we know that someone has multiple chronic conditions, as I'm looking at bottom right, that's an important piece of context for that person and communicating with them. You can look across these. I mean, one we're always talking about is not just the reading level at top right of maintaining that 5th grade reading level to increase accessibility, but that's the general headspace we're in. Well, we might also use iconography, because that grade reading level might be directionally right, but you might have people that are looking at this from a foreign language that you haven't covered, and use of iconography can really connect the dots to help somebody have a better understanding of what it is that you're, one, telling them, and two, asking them to do. So this is a great one. I know the materials are going to be shared, but to just sort of like review these and get your head in this space, as we're authoring things that are going to go out to members, that can be a really helpful place to start. Another place that we spend a ton of time is if we're about to reach out to a population, well, what do we know or believe to be the barriers relative to the action that we're asking a member to complete? Okay, and so if we're using that instance of telemedicine, for example, well, maybe there are certain tech parameters that we would want to connect the dots on. Maybe it's the easier link button to an Apple App Store or to an Android store to be able to download that. Maybe we understand that there are some, security concerns on a cell phone that we could alleviate just by putting the right messaging into that letter. But if what we're asking someone to do is download this telemedicine app, and then you can use it to talk to a doctor, well, let's really think through that from the perspective of someone opening that message and what constraints they might have in their own mind and thinking, well, maybe I don't want to do that. Maybe I don't know how to do that. Maybe I tried to do that and it didn't work. All of those are really viable endpoints for someone who's reading this message. And if we're not addressing them, then they're going to do what we all know from a marketing perspective, which is called they're going to bounce. And they're not going to try again. And in addition, the next time they receive something from us, they're starting from a deficit in terms of a trust and an expectation that this is going to be highly valuable. And so we're just losing that connectivity with those members the more that something is difficult if we're asking them to do something and we haven't explored all of the ways that there might be barriers there and started to address them. So you can see these are for another couple of examples, but medication adherence, colorectal screenings, mammographies, all of these can be improved and increased in terms of the utilization of them if we're coming from a barriers address kind of approach first. Now, once we understand barriers, and again, if you're thinking about that welcome letter that might be going out to, or welcome email that might be going out to a member, it's easy for us to look at, and we've got examples later in our presentation today of, how does a final letter look to a member out there, a prospective member? It looks like words on a page. And that can lead us as authors to think that as long as we're including the really required information, we don't have to do a whole lot more than that. And the ask and the encouragement here is to recognize that words and the way we use them have a profound impact on somebody's resonance with those words. I think there are really easy consumer examples. Even if you're just imagining being in the grocery store or the drugstore and you're going down the toothpaste aisle and you've got the exact same product and in one version of the box it says whitens teeth and the other one says prevents cavities. Well, that's a company that is really leaning on the idea of different messaging might have different resonance. And I guarantee that those organizations are collecting that information and saying, wow, we perform 2 to 1 better on the prevents cavities. We might want to start including that in more of our messaging. So the point then, coming back to some of the correspondence that we all have the opportunity to author, is there are principles out there that are beyond just grammar, spelling, and punctuation. And starting to play with these ideas like choice architecture or authority, where right in your letter it says, the American Medical Association encourages you to get your flu shot, or your doctor, and insert the doctor's name, is encouraging you to get that flu shot, something to that effect. Those can have a much different resonance than simply saying, schedule your flu shot today. So the inclusion of that does not cost a dime. It doesn't cost any extra effort or time or expertise. It really just involves, we want to try this out because we think that speaking to people where they are and with some of these behavioral science mechanisms might increase our yield. And again, I know what's music to every health plan's ears is we were able to do a lot more without even having to ask for additional spend. This is one of the easiest places to do it. So we've got some of these principles laid out here. It's certainly not all the ones in the world. And it's certainly not to say that certain ones are right and certain ones are wrong. I think my encouragement would be, whether you're using these or something else, just to be deliberate with the language in these communications and to know how you are trying to write it, how you are addressing particular barriers that you either know to be true or you're sort of hypothesizing are there, and you're trying to overcome them. The key word here is try. There's a whole spectrum of ways that you could measure this, that your vendor partners could measure this on your behalf and give you results back. But I guarantee if you're looking at correspondence and just saying, we're going to try to overcome what we know is a barrier for our membership by using this idea of let's present safety through the idea of authority, for example. If you're trying that, you're definitely moving in the right direction, and you're probably outpacing some of the competition, other health plans, et cetera, probably also getting better engagement from the members that you do have under your plan. So then earlier we talked about care access being one of the really critical things that we know is invaluable to a Medicaid audience. It's about options, it's about flexibility, it's about meeting people where they are. And so talking about something like, an available telehealth program, that could potentially be what is most valuable to all of your executive leadership from the standpoint of, man, we have just got to get people in front of a doctor. And even if that's in a digital capacity, that's where we can make up the most ground in terms of really connecting with people on the state of their health. But it should start as an open discussion. Whether you're looking at specific conditions, and maybe there's a partner program or something for diabetes management that you really want to be promoted and out there, that might be the right, what we would say, call to action within any of your member correspondence. So this to me is where the correspondence team, which has always been just sort of charged with writing these letters or these emails or whatever those may be, and then sending them out, it really builds a bridge over to the engagement side of a health plan and says, where are we trying to move our membership to? If we ran into a member on the street, what is the one thing that we would ask them to do to help improve their own utilization of the benefits they have to help make them healthier? That's the kind of material and content and call to action that we want to make sure is consistent from, again, like that executive leadership perspective of what's most important and what's most costly to the health plan. That's where we should be. That's where we should be closing the gap on utilization of more people being nudged towards that thing, towards that benefit. So again, we said we'd kind of make this real, and I just wanted to bring some color and light to the different ways that, in this example, an ID card and a letter might look. And what we oftentimes see are versions that are represented by the content as the sort of in the backdrop of this page, where there's actually the content might be fabulous. But from the standpoint of, are we leveraging everything at our disposal to make it as compelling as possible? That's where we might encourage, again, the same exact cost to send out the letter at the forefront as the one at the rear, but we might have an opportunity to get better engagement if we tinker and tweak and leverage some of the principles that we've discussed today. So the inclusion of a QR code to get to that telemedicine service or to download that telemedicine app, go to the portal, whatever that might be, that can be a huge bridge that is oftentimes not included in traditional plan correspondence, especially for a population that we know is many times on the go, or they're mobile first, or might not have the exact same computer access or computer literacy. That QR code is something that we know is native to their everyday way of life. This is how we're scanning menus. This is how we're doing any number of things to sort of take an action. That's where we really want to meet that member, is with the inclusion of that in all of our letters. You're also seeing examples here that lean on behavioral principles of, if I see two checkboxes that are completed, one, that's a vote of confidence that I'm doing things right, that I'm aligned with my plan, that I'm getting that feedback of I'm on the right track. But that last one being unmet or not having a checkbox in it yet is a little itch from a behavioral perspective of, that's the thing I need to go do. I need that sense of completion. So lobbing in what it is that we want to nudge that member to do, and with that last checkbox that's unfulfilled, again, this is not necessarily going to make every single member take that action. But if in the version at the backdrop, we were going to have 2 people take the action out of 100, and the version in the front, we were going to have 7 people take the action instead of 100, start to do that math. And at the end of a year or 2 years or 5 years, there will be thousands more people who are involved in a positive way in the benefits in their health plan, just simply by doing a design in a more behaviorally relevant way. A place that we really get excited when we talk to health plans is encouraging them to think about the strategic value of an explanation of benefits document, and knowing that immediately after, especially if there's a chronic condition at play or if there's an acute emergency at play, we have a member's attention in a way that we very rarely do throughout the year, and in a way that from a marketer's perspective is highly effective and highly valuable. My attention to any of the documentation following an episode such as that is probably heightened to the degree that I really am giving the time of day to correspondence that relates to that episode. And so if we've always, EOBs are the prime example of something that looks like it was built by a mathematician and by an actuary, and for some reason, I, as just a regular old person out there, am receiving it. If we can change the voice of that explanation of benefits document, which does not mean to change that much of the formatting, and I'll speak to that in a second, certainly doesn't mean to change the nature of the content, but if we can layer in, hey, this is the explanation of benefits for your recent visit. By the way, here's a link to a diabetes prevention program that you might find valuable. Now, if that's related to a recent A1C or a glaucoma specialist or something else related to that condition, boy, have I struck while the iron's hot there. And boy, do I have the opportunity to get that member the benefit that they would value and the benefit that we as a health plan have invested in. Now we're starting to think about there are regulatory constraints around some of these documents. What we're looking at on the screen here might be more provocative or might be something that is outside the lines from a compliance perspective of what your team is comfortable taking on. I would encourage this, even if you leave the existing document completely on its own and don't touch it, there's almost always an opportunity on an address sheet, which has this huge white space at the bottom of it. And it's just begging to be used for something that's a little bit more consumer friendly. That might be the only thing that really gets read and comprehended and understood in the opening of a letter or an EOB document. So at the very least, use that bottom third of an address sheet to say, here's something that's really member friendly and really has an opportunity to get somebody to start taking action in a particular direction. Member guides are going to sort of follow suit in this. And if this is a piece of correspondence, either digitally or physically, that is sent out to members, this can be a great opportunity to have a little more space to breathe, really give people more of a buffet of options, of well-presented options that say, here are the relevant things. Did you know you had access to them? Almost invariably, and I think we could all look in the mirror and say this about ourselves, do we know everything that's in our benefits plan? Likely it's of course in there, it's available to us, but if we're not having the invitation to participate in it in a relevant and sort of consumer-friendly way, a lot of those things are simply not going to be seen, not going to be understood, and this ends up to the tune of many, many, many dollars in added cost, both for members and for health plans over the course of their health journey. So closing that gap on something like a member guide is another great opportunity here. So let's do, if we were working with a health plan, and again, encourage you to do this with whomever you're working with, but let's start with the goal in mind and then actually walk through an example of how we might make that goal more achieved by more of our membership just by taking this approach. So this is kind of our case study lesson in action. We're going to look at the participation in flu shots and start off with just a little bit of research, which is that there are some best practices around driving flu shot participation and things to just keep in mind. Some of these might be relevant, some of these might not be achievable, just depending on what you have access to or how you look at sending this. But when we think about consistent and commonplace messaging, frequent throughout the year, that might not even just be what we send in November, December, January includes this messaging. But if this is really a pain point, we see a lot of flu cases end up in the emergency department. It might be something that we actually educate the member on across the course of the year. You'll see, again, the use of things like QR codes. You'll see extending into every calendar year. Keep trying, especially if somebody maybe did have an episode in the past year, that might involve messaging that's a little bit different. But now we talked earlier about the importance of starting with a recognition that barriers do exist. They always exist. And so really getting curious about what those look like and working with your team, and this might involve, I mean, this can be a great exercise because it brings in team members to really contribute to what the barriers for members might be. But we've seen some that look like this. And so this is like a great brainstorm on a whiteboard with your team. But I'm healthy. I certainly don't need a flu shot, and I'm not going to read each one of these, but just to pick a couple out here. I don't like getting shots, or I don't trust getting shots. I can't afford a medical bill. I can't get to the doctor's office. All of these things would absolutely be ones that we would hear from members if we were to just say, hey, get your flu shot, either in the back of their mind or in spoken word, they would be sharing things like these quotes. So we can then sort of bucket them into what we know are these categories. Like we're seeing misconception about the nature of, in this case, the flu shot. There are always fear elements when it comes to healthcare, whether that be a literacy fear, whether that be a pain fear, or if there's an outcomes fear. There's convenience and there's access, there's location, there's cost. But starting to really get a sense of what are the nature of barriers out there, and then which ones do we want to address. And what that immediately maps over to are those same barriers as written at the left, and then a brainstorm on what could the messaging look like to overcome those barriers. It may only take a sentence, it may only look like one statistic, but you've got the opportunity here to turn this letter into a barrier addressing communication that is alleviating fear and lowering the walls between the member and participating in this particular action. So a little goes a long way here, especially when we're distributing out to tens of thousands of people. So a great one just to use as an example, again, if you've got this when you receive the materials, you'll know exactly how to plug and play what different barriers for different members or different actions sound like, and then what some of the messaging can look like there. And then all we're doing is making sure that we're layering those things in to the communication that we develop itself. So now we've done the exercise of acknowledging barriers. We've done the exercise of how we want wording that really feels like it addresses those barriers. Now, how do those fit into the form factor of a piece of correspondence? And so I always call these like our John Madden versions of slides of like, we're running a play, and we're running a play through the copy and through the design of the letter that's being sent to a member. In this case, it's not just, okay, here's the contact number, here's a really nice, friendly introduction, but we're actually leveraging principles that we know attack pain points that reduce participation, and we're going after them specifically. So this is just a savvier way to get more out of the exact same cost on that distribution, but we've now done so in a way that's loaded up with behavioral principles, behavioral science, and we know empirically has a better opportunity to get people to participate and improve their state of health. One of the things, just as a courtesy that we do, and again, there's not an ounce of today's discussion that's a pitch, but if just further engagement in the concept is of value, whether you work with us or you don't, whether you have any intention of working with us, one of the things that we do is just consultations and giving a mock-up on, send us what a letter looks like today. Tell us what your biggest priority is that you want members to participate in, and we'll do just a quick mock-up and then have a discussion with you around, here's how we might go through the process of thinking about creating a letter that has an opportunity to drive more participation for you. So you'll, of course, have this when you receive the materials, but there's an email that you can reach out to us, and trust us when we say that that doesn't turn into a, try to solicit your business, but we're happy to share more about what we do if that's helpful and how we integrate this into all of the correspondence we do. But that's just a free courtesy on these ones too.